Quatsis ahno temish, washing the metal poop, Gaita dawa how Ska Sam, Ska was Ska you temish, Ska temish, Ska Papa, Ska Nana, Ska Tao temish. Ko hat onatsi at jasti skautan, Skaita dawa how etsi, Strua, dawa how etsi, Tia hopa. Gairwa, dawa etsi echo, and Thomas did see sty a truth. Da as ahno temish me yona, Kutru ostia, Baho etsi, Tia. An etsi skuna matzanish, dawa sis naitra kuni. Me yona eme etsi echo, Ayet, Kutru si fruits hopa. Kai tawa an hima tawa sis ka aititas, si tawa sis ku autitas. Kai ekuskuto nimastat, me yona to chayus. Hiats en me yona zik anders, sisku ak anders. Kai etze me yona zik kai kanashian. Et hima tawa si ka aititas, si. Yumu hau etzi stra kani hau si TV ko skum egum, ko news skum egum. Eme hau etzi kaupers, si. Tawar si stuna si suits atas to chayur si amu hano ho etzi zu apetsanish et show me yona eme etzi ho pan idrana tawar si snaitra kunish si ku kai tawa to wawa tseshinish hima me yona eme ko si a iza to esti ko owa tsekus si hey a shahano timish pa shutzi na si skutjawani. He si kai parshu si truchani shu opa. Ta kai hat tuk enak si nu a pesho tuma kai me shami si achach trus. Tuk enak si eko kai merkan shia. Eme si eko na nu a pesho tuma. Good afternoon, everyone. It's good to offer this message to all of you today. I apologize for it taking a while. It's been extremely busy here at the tribal offices, but I wanted to provide a brief update on a few things to all of you. I first want to extend my well wishes and greetings to your families here at home and those who live away from home. I hope that all of you are doing well and have been vaccinated or have plans to be vaccinated. And I just want to say thank you, express our thanks on behalf of the Tribal Council, Tribal Administration, our traditional leaders at Acoma. We all appreciate everyone's continued understanding and cooperation with the executive order. I know that all of us would like a lot more freedom, but it is still a dangerous time, though things are getting better. And I'm really, really grateful that we are seeing some change, some positive change that's occurring throughout the world and throughout the country, and certainly here at home. I want to, first start off by saying that, it's been hard. I think we're all, just really anxious to be with one another, be among our families, be among community. And, I know it's frustrating. It's really hard. I myself wish that I could be with my family. We haven't been together, my siblings, my brother and my sisters, my nieces, my nephews, for over a year now. And it's really hard. I haven't even been able to visit with my relatives who live here because of our executive order. So we're all making great sacrifices, and I appreciate everyone's cooperation, everyone's participation. And we'll get to that point where we can begin to share time with one another and just re-engage on all levels. But in the meantime, we still do have the executive order in place. We've issued an amendment just this week And so I want to go through a few of those and to clarify some things for all of us. But first, I want to start off by talking a little bit about vaccination. As you know, the vaccine is available. There are now 3 different types of vaccine: the Pfizer vaccine, Moderna, and now the Johnson & Johnson vaccine that are available. Now, the tribe has been receiving the Pfizer and Moderna vaccines through the state of New Mexico, and all of our vaccination clinics continue to be co-managed by the Department of Health and our Health Command. ACL Hospital also receives a certain amount of vaccines from the Indian Health Service, and so they have also been providing vaccination and testing for not only our tribal members, but also our neighbors to the east and people from the surrounding communities. As you have probably heard on the news, there is, we're going through the phases of vaccination, and on the state level, vaccination has become more open and available to a larger population of people in our state. And we're seeing this throughout the country as well. We are fortunate as Native American tribes throughout the country to have been given some consideration, some priority to access the vaccine. And so I'm very grateful that we've been able to vaccinate a large number of our community. We still have some work to do, but we are making some good progress. And of course, as soon as we have reached what the public health profession calls herd immunity, which is a time when a large percentage of the population is vaccinated in a particular area, it opens up more opportunities for us to engage among community and with family. And so that's what we're working towards. We're not quite there yet, but because we have vaccinated a good number of our tribal members, we're able to issue this amendment that calls for certain lifts of the mandates and the provisions of the executive order. So, we are, we'll continue to host clinics. We have a vaccination clinic coming up next week, Friday, on April 9th. And this is a really important clinic because this is one where this might be one of the last times that we offer the vaccine that requires 2 injections. And we're hoping that we can also then begin receiving the Johnson & Johnson vaccine, which will only, of course, requires just a one-time vaccination. But this upcoming clinic is really critical because we need to vaccinate as many of our adult community members as possible. Now, we've also received news that individuals and our children 16 years of age and older are now eligible for vaccination of the Pfizer vaccine. And I believe that ACL Hospital has administered some of those. And we want to be able to administer more of that age group, the vaccination among that age group. So please look out for notices from our Health Command and our Health and Human Services Department, as well as ACL, that will announce those clinics where children 16 years and older will be eligible for vaccination. There is also ongoing testing. That's trials that are happening within these various laboratories to determine the safety of vaccinating children 6 months and older. This is really important, as you know, because we want our children to go back to school. We want our children to be able to participate in sports. We want our children to be able to be together here on the community. And so this is really important, and it's exciting at the same time, but we need to be patient just a little while longer. But I'm hopeful that there will be a vaccine available for children, maybe this summer, maybe at some point during the fall. But in the meantime, we still have to protect our children because there's no vaccine for those under 16 years of age. But we will provide you with additional information. And if you have access to technology, monitor the social media of the Health and Human Services Department and also our Trouble website, which will offer information about any new developments around vaccines for children. But in the meantime, our efforts remain in the area of vaccinating our adult community. Very, very important that we all get vaccinated. And I know that there's still some reluctance among some tribal members, and we understand and we respect the decisions of people. But in order for us to achieve that herd immunity, we have to reach that high percentage of community members who have been received a vaccine, so that we can consider opening things up a little more for our community. But if we don't reach that herd immunity, then we're still at risk as a community. Our families are still at risk. It means that we also might still have restrictions as far as access to Old Acoma, and of course everything that we're all just anxious to do is to re-engage with our culture. But until we reach herd immunity, that's not going to be possible. So it's very, very important for us to come together as a community and be reassured that it is safe for all of us to accept and receive the vaccine. Many of us have gone through many different types of vaccinations. We get, flu shots annually. We go to the doctor. We seek Western medicine to help us, heal, many of our tribal members. Unfortunately, and my own family members have to rely on Western medicine to combat heart disease, diabetes, and other illness. So, we look to Western medicine to help us, to keep us healthy, but to also supplement our own traditional beliefs and power and belief in prayer, and also our own traditional medicine. And so it's, this is part of our livelihood today, is the reliance on Western medicine. And so I encourage all of you, and those of you who might still be doubtful or scared and about receiving the vaccine, please be assured that this is safe and it will protect you. It will protect your loved ones, and ultimately it will help us heal as a community and afford us the opportunity to be together again. So I want to get into the amendment. The public notice that I issued this week highlights aspects of the executive order that have been modified. It doesn't include the entire executive order. However, the executive order is available at the HHSD website, or you can stop by the tribal office and request a full copy of the amendment if you wish. But we highlighted areas in the amendment so that you're aware of some of these key issues that we all need to be aware of, and hopefully it allows all of us a little bit of breathing room as far as curfew and lockdowns and access for other activities on the community are concerned. So I want to start with the uh, area of schools. Our children remain in virtual learning. Our tribal controlled school, including the Agua Community Academy and the Agua Learning Center, will remain virtual for the remainder of this school year. But as you know, Grant-Cibola County schools and other schools throughout the state where our children attend have opened up and will open up on Monday, April 5th, for in-classroom instruction. And so we have a process that we put into place when the re-entry for the hybrid model was approved by the Grant-Cibola County School Board. And so we're going to follow those same guidelines for those families who wish to send their students back to school. And I just want you to know that, I'm really grateful to the parents and families who have opted to keep their students in the virtual learning mode. This is the safest for our children. Almost every week we receive a notice from Grant-Cibola County Schools of exposure of the virus. Either a teacher has contracted the virus, or other staff members have contracted the virus in the various schools. And in the last few weeks, unfortunately, with the re-entry model, there were students at some of the schools who contracted the virus. So it's still very, dangerous. And because our kids are not vaccinated, they're still at great risk of contracting the virus. So for these reasons, we want to ensure that our students and our children are protected, and we're encouraging families to maintain their kids' learning virtually through the end of this school year. There's about 5 more weeks left in the school year. However, those of you who might be considering sending your kids back to school, again, we will be following the same guidelines, and they're stringent because it calls for a great amount of responsibility on the part of the families, where transportation is concerned, monitoring your family, the entire family, since students will be returning home after a full day at school. So there are many guidelines that we require, and so if you do have an interest, please you can visit the Health and Human Services website, and the attachment that's referenced in the public notice is available there, and it provides you the guidelines for students returning for in-classroom instruction. In the meantime, I encourage all of our students who are all doing a great job, the families, the parents, grandparents, brothers and sisters, aunties and uncles who are all participating and offering a hand to help our students get through this virtual learning phase. And we're all hopeful that come the next school year this fall, that we'll be able to safely send our students back into the classroom. So we're all looking forward to that. And I know that our students really miss being with friends, participating in sports and other school-based activities. So we're looking forward to them having that opportunity to go back into the classroom. The other thing is curfew. Curfew is now, you have 2 extra hours. Curfew begins at 10 p.m. each night and will run through 5 a.m. in the morning. That's every day. So please keep that in mind, 10 p.m. until 5 a.m. The other modification was regarding arts and crafts and food vending. That is now open for on the reservation. We do require that each food vendor submit a current food handler's permit to the Health Command. And on the public notice, you'll see the email address to send those to. And the Health Command will issue a permit so that you have that in hand and when you go out and sell your food or arts and crafts. So we appreciate everyone's patience in arriving at this time where we can have active food vending on the reservation. The other is ABE under the executive order and the Tribal Council have approved the ABE to reopen the main casino operation, and they will begin that on April 19th. Now, you all know that some other of our other businesses have already opened, including the travel centers, and the hotel and the restaurant, and those will maintain operations. They are not operating at full capacity just yet. It will take a while for us to get there, but we are taking these incremental phased steps to reopen our businesses. So this is very promising because it means people can get back to work, our travel members will have an income, and that we begin generating some revenue to support the needs of our community, the services that we provide to the community. So we really appreciate everyone's patience. We're anxious to get people back to work, and we'll continue to work towards opening some of our other travel businesses, including the cultural center at Acoma, but that's likely to be not to happen anytime soon. But we are, the staff there and ABE and the business board are looking at creative ways of still engaging in some level of business there at the cultural center. The other thing is the checkpoint. The checkpoint is not going away. The checkpoint will maintain its operation. Just like at many other tribes throughout the country and many tribes here in the state, there is a one point in and out of tribal lands. And so we will maintain this operation. We're grateful to the staff there who are doing the best work that they can. And we realize that there are some days when there's inconsistencies. And that's not to speak bad of the staff there, but some days are overwhelming. Some days, there are tribal members who maybe have special considerations that we're not always prepared for or don't expect. And so, the staff there continues to do the best job that they can. We ask for your cooperation and patience with them. We've asked them also to continue to offer good customer service, to be considerate of of all of our tribal members who are traveling on and off daily, with more people reporting back to work. There's going to be more traffic going through the checkpoint. So please be patient and offer your cooperation is all that we ask on their behalf. Weekend lockdowns are eliminated. There will no longer be weekend lockdowns. Weekends are open, but please keep in mind that the curfew remains in place, 10 p.m. And those of you who travel to Albuquerque for essential business, please plan accordingly because of the road construction. There's often accidents on I-40, so please plan ahead. Make sure that you are departing at a reasonable hour and allow yourself that extra time for the travel back so that you arrive safely back home. There have been a lot of questions about the amendment and how this impacts the ability of children and elders to leave tribal lands. In the full amendment, it does indicate that at this point, children 16 years and under still cannot leave the reservation. And again, that's because they don't have the opportunity to be vaccinated. They're still at risk. And so we still need to protect our kids because they too can be carriers. Unfortunately, we've had some cases where on the reservation of children who have contracted the virus, and it's just devastating, of course. And so we want to continue to protect our kids. And until there's more information about and access to a vaccine for our children, it's likely that they will continue to be restricted. Now, children can leave for school-based activities, for medical appointments. All those just need to be cleared through the First Lieutenant Governor's office. And so we continue to ask for your participation. All of you have been great at providing, information ahead of time. So thank you for planning ahead. It's working out really well with those authorizations. Sometimes First Lieutenant Governor doesn't have to, review these in any great detail, because a lot of you provide all of the information that we need to know that for those authorizations to be granted. So thank you for working with our staff. Tony Chino, Francine Torrivio, and Jordan Patricio, they're some of the first people you're talking to, and so we continue to ask that you work with them and provide them the information so that those authorizations can be granted. There's a mask mandate as well. We continue to encourage that. I took my mask off to do this video, but we always wear masks here in the tribal building. And we encourage that. Well, if you're at home, traveling to appointments, especially if you're going to the doctor, please make sure that you are taking every precaution, wearing your mask, using hand sanitizer, washing your hands, and just being extra careful, using gloves. All of this is very important and helps us to protect ourselves and each other. Out-of-state travel is changed also in the amendment. There is no longer the 14-day quarantine, though we do, if people, tribal members are traveling from coming back here from out of state for visits, there is protocols for associated with that, and those are identified in the original executive order, and most of that is still in place. So please continue to follow those guidelines that are in the executive order. Places of worship, we are going to begin discussions with the priest to allow for a limited number of people to attend Mass on the weekends, and perhaps maybe even a day during the week, so that we allow our Acoma people that opportunity to go to church. We'll likely reintroduce these in May, and they will be very low numbers, just like phasing in our businesses, reopening of our businesses. Our church services will be limited to a certain number of people. And so we'll keep you informed when all of that has been discussed with the priests, and we'll let you all know what those parameters are going to be. And finally, of course, there's the vaccination mandate. And this is really intended to encourage all of us to be vaccinated, to get the vaccination. And by the end of May, we should have a better idea of where we're at towards achieving that herd immunity. And so the mandate is really calling for all of us to receive the vaccine. And hopefully by the end of May, we'll have some really good data that will inform us then of what we can be doing, or if there's still more, if we don't reach herd immunity by then we're going to probably have to take other measures to ensure that we reach herd immunity before the summer. It's just really important that we achieve that sooner rather than later. So that vaccination mandate is in progress, and like I said, we have a vaccination clinic coming up next week, Friday. If you have not been vaccinated, please make sure you sign up. And the information is on the public notice. You can call HHSD to sign up for vaccination. Inform family members who live off the reservation to come out and be vaccinated. And most important is for those of us who live here, we need to be vaccinated. So make your appointment, get it done. It protects everyone, and it keeps us all safe and in good health. I also want to thank everyone for submitting responses to the survey. I encourage all of you to, I did encourage all of you to submit that, and we had a good response, and it was really informative. And so a lot of you encouraged us to continue to make these videos. It was especially helpful to a lot of the older population here on the reservation. but it's also helpful to our tribal members who live off the reservation. Many of them also express that these videos are helpful for them to understand what's happening here at home. Many of you also expressed a need for a newsletter, and so we will be initiating some discussions about how we can achieve that and develop and publish a newsletter for community distribution. So look out for that here in the coming month. And also, and I'm really grateful that many of you were interested in attending virtual meetings, including virtual general meetings. So at the next Tribal Council meeting, we're going to be providing the council with this data and encouraging them to schedule one of our first, well, it would be our first virtual general meeting. And we hope that it will be taking place later this month. So we will alert you all of those dates and the process for tuning in for those general meetings. Hopefully later on in the year, we can have in-person general meetings. But until then, we're going to move forward with the virtual general meetings settings. The cultural calendar is under review as well by our cultural leaders, and we will provide you information once we have that. As you know, there are many things that will be coming up, and so our cultural leaders, our Antelope Clan, our field chiefs, war chiefs, and their mothers, as well as the Kiva leaders, have been convening meetings, and they're ongoing. And as soon as they let us know, we will inform you of what their decisions are regarding some of our cultural activities. But of course, we are always encouraged to continue our prayer, continue in our own ways to observe the events that have happened and will continue to happen through the year. So we will keep you posted. Ditch work is underway. There's been some good progress made, so thank you to all the men and boys who have showed up. Those of you who live on the reservation, thank you for coming out to ditch work. And ditch work has been, will not resume until Monday. They will begin at Shativaville area, Tashka. So please, if you have that extra time, go out and support our water bosses. They still have a ways to go, but we look forward to having all of the ditches cleared so that it's prepared for the water to come back through. And of course, we're all hoping for more rain and moisture so that those waters can flow through our community and be available for all of you farmers out there. So with that, I want to end here. Thank you very much for your attention. If you have any questions, please call us, contact us. Many of you do that. I really appreciate that. I mean, that's one of probably the greatest things is that during this time of pandemic, you all reach out by calling, you send email, some of you text, some of you send messages on Facebook or other social media. So we really appreciate that when you're all calling to ask questions, or if you're asking for clarification, or if you need authorization for something. Thank you for contacting us directly, and we continue to ask that you do that. So with that, I want to end here, and I'll end in our language. But before that, I want to extend to everyone very best wishes for a blessed Easter and springtime. Please continue to take care, be cautious, be careful, be good to one another, and know that all of you are in our prayers every day. Thank you for your cooperation and understanding during this time. We're all going to get through this. We're almost there. We're going to get through this. And we look forward to providing more information to you during the virtual general meetings and with future videos. So, taas ahnu temish, tawa ekaiton ksiako achatris si jutranit, kai shaiwan namati, taapa kai me etsi try up en akuatuk en ksi shai titach. Kutsa ai hatsi shoma tawanat, haitsi ai te marshatsi tru, te mitanu, pa kai me jaiwash aitsani, kai sefk ni wa bersho trumersi. et kai shaiwana mati hopa emetsi ko kai shru ashkits amu show et hopa me yo na zi noi amats ats amu ma shau dranish near amu makro he ma shau dranish near to at the hosti no ota anna shrusti amu ma zi na trade down kutrus he ma say how yam zi kuma hoka drunitsi shama shanu he ma nai nestiets ayut to ersi na emetsi umas nia watra nish quatrama amustis ne art quatrama kotona sto ayush Hiats in het onasti sterk sieko no anatko. Ja anatra za aumas sieko. Zatsna hawe hanu tika si not ataya kun ko ni wa pets sort man et himas ek tawas sis na itrako. Daas aan tim spa hawe na zit stro ostia. Shramit zi try ashut an a try minatat. An et zi skona matsanish si ne trust kutroma. Himas ek shaiwet zana maikwe kaitrani. Zikana anetzi sna chana shusti amusti sna yatrana shust hopa ko anetzi kana hosti snot ana shust shau you kai shatsuts da it me yona ze ko pa hawena stia afkama stiu shapuma as each extianis etze hawena zi straight trust hopa da hinama shaka so es so shatranos ties emita pup sivitsuit nich Bars no it's nine. Is die tapup zi abka shum hem et anish at shrana is used and yet at stay in the highest kaitran. Not stisne ar say at use quarter zi amos stisne art quarter stisne wawa type naish quarter Eme bars wais wamak ka iani ka tsats ka timi ka itzat. Bars zi not straiwaya need hopa. Da hopa to always shots on the teams ostia pa wet. Thank you everyone. Have a happy Easter. Bye-bye.